October 14th, 2024, 2:14 a.m. St. Jude's Memorial Hospital, Operating Room 4. Outside, a torrential downpour masked the eerie silence of the city. Inside, the atmosphere was suffocatingly tense. On the table lay 24-year-old Clara Vance. A horrific car accident had torn her aorta. She was bleeding out, her life slipping away with every shallow breath. Her only hope, Dr. Robert Kingston. At 58, Dr. Kingston was a legend, a maestro of cardiothoracic surgery. He had saved thousands of lives. But tonight, the stakes felt different. Looking down at Clara, he didn't just see a patient. He saw a young woman with her entire life ahead of her. He took a deep breath, his gloved hands steady, and muttered his usual pre-surgery mantra. Not on my watch. Let's look at the timeline of a night the medical staff at St. Jude's will never forget. The surgery was underway. Dr. Kingston's precision was flawless. He worked with speed of a man racing against death itself. Clara's vitals were highly unstable, her blood pressure plummeting. The heart monitor beeps were erratic, a frantic cry for help. 45 minutes later, disaster struck. Clara's heart stopped. The room erupted into controlled chaos. Charge to 200. Kingston commanded, his voice a pillar of absolute calm. Amidst the panic, one shock, nothing. Two shocks, still a flat line. Kingston refused to give up. He began internal cardiac massage, literally cradling Clara's heart in his hand, gently squeezing it, forcing life back into her body. 3:40 a.m. It was exactly at this moment that a silent killer struck Dr. Kingston. A massive catastrophic myocardial infarction, a heart attack. A searing, blinding pain ripped through his chest, his own left anterior descending artery. The Widowmaker had completely blocked. His vein blurred. The room spun. Any other man would have collapsed instantly. But looking down, Kingston saw Clara's heart give a faint, weak twitch. She was coming back. If he stopped now to cry for help, if he let go of her heart for even 30 seconds, Clara would die. He had a choice: save himself or save the stranger on the table. He didn't hesitate, biting his lip until it bled to fight off the oncoming blackness. Kingston kept going. He whispered to his chief resident, "Keep her oxygen up. Don't look at me, look at her." For 20 grueling minutes, Dr. Kingston fought two battles, one to save Clara and one against his own dying body. With agonizing effort, he placed the final critical sutures, repairing Clara's torn aorta. Clara's heart was beating on its own. She was stable. She was going to live. Kingston let out a soft, red sigh. He stepped back from the operating table, nodded at his team, and said, "Finish up." And then he collapsed. The medical team immediately swarmed their mentor. They spent over an hour trying to revive him. But Dr. Robert Kingston was gone before he hit the sterile floor. He had poured the final remaining ounces of his life force into the hands that saved Clara. 2 days later, Clara Vance woke up in the ICU. When they told her about the man who had died so she could live, she wept for a doctor she had never truly met. They say a surgeon's job is to keep hearts beating. On October 14th, Dr. Kingston proved that sometimes to keep a heart beating, you have to give your own.